Good morning and welcome to IRG Physical and Hand Therapy's Health Talk. I'm Ron Schakal with Shannon O'Kelly, president of IRG Physical and Hand Therapy. Good morning, Shannon.
Good morning, Ron. How are you?
I'm doing well. I'm filling in for our friend, the legendary Tom Hutler, who is home recovering from some stuff, and we hope he's back soon.
Absolutely. Big shout out to Tom. Tom, get well. We've got you. We can take care of you. Physical therapy is what we're going to do for you.
There you go. And right now we're going to talk to one of your new employees in Bellevue.
Yeah, Jessica is a new physical therapist. We're super excited, Ron, to be opening up a brand new physical therapy facility clinic in the Bellevue Commons, so we can serve that east side, that Bellevue population, with a lot of different physical therapy interventions. Jessica has extensive experience in musculoskeletal care, and more importantly, she has a specialty in vertigo and balance. We're excited to have her.
That sounds great. Let's hear from Jessica right now. Here's Shannon and Jessica.
Jessica, thank you for joining us today on Health Talk. Welcome. More importantly, we are so glad you just joined us here at IRG as a physical therapist for us at our new location in Bellevue at the Bellevue Commons.
Thank you. Yes.
I mean, I'm excited. You're excited. You've been awesome to work with during our short period of time here, but we're looking for a long relationship and some future success, particularly in Bellevue. Tell our listeners about your background as a physical therapist, your training, kind of your area of interest. I know you have an interest in vestibular rehab, and I don't think our listeners really know what that is. So let's just catch up with Jessica, okay?
Sure, yeah. So I grew up in New Jersey. I went to undergraduate and physical therapy school in Connecticut. After PT school, I moved out here. I worked as a physical therapist for 3 years before I started here. I had a lot of experience with any orthopedic conditions, post-op, like sports injuries, overuse, and like you mentioned, the vestibular rehabilitation, which is just basically if you're having some like symptoms of vertigo. We hear that a lot, where you're feeling like you're spinning, your environment's spinning, any type of dizziness. That's kind of falls under that whole vestibular rehab. So I can do that. I've had some further training through the American Institute of Balance, and just really cool getting to like treat people that. It can be extremely debilitating. So it's a really cool area of expertise, and I am really looking forward to getting people in there.
Yeah, you have a background in musculoskeletal, so you can treat general musculoskeletal injuries, shoulders, knees, backs, necks.
All of that, yes.
All that, yeah. I mean, extensive background. You also, I love the fact that you have this specialization in vestibular rehab, and that's that vertigo or that balance problem. So maybe address that. How do you treat that? I don't think people are aware that physical therapists treat that. Yes.
Yeah. I don't think there are a lot of people out there who know exactly what it is or what we can do for it. But depending on what is causing your symptoms, there are a lot of reasons why you could be experiencing this. The most common is the BPPV, the benign paroxysmal, the positional vertigo, BPPV. And although that's the most common, there are other causes for your dizziness. So we will take you through a bunch of different special tests, examination tools, and then we could just go from there.
Just the assessment that you're able to do and identify problems and create some interventions. I mean, the results are pretty fantastic. And, you can improve someone's balance with just some therapy, right?
Yes. Absolutely.
Yeah, so tell us as we wrap up here, you've been great. Again, thank you for joining us. Again, we are so excited to have you here at IRG as our physical therapist there in Bellevue. You're in the Bellevue Commons. It's conveniently located, easy parking, easy access, and you're taking patients as we speak.
That is correct. We've got a really cool area here, lots of equipment to get you training. We got a lot of tools for everybody out there.
All right, Jessica, thank you so much for your time. Thank you for your information. We're excited to have you at IRG and part of the IRG family, creating family physical therapy and neighborhood physical therapy. Thank you, Jessica.
Thank you for having me.